Hello, my name is Sophia Robinson Harris, and this presentation is about beta thalassemia. This presentation will include an introduction about beta thalassemia, what the disease is, how it is obtained, clinical manifestations, epidemiology, and risk factors. In addition, we'll look at diagnostic testing, treatment, prevention, education, resources, and then a brief conclusion. The learning outcome for this presentation is to increase knowledge about beta thalassemia, treatment modalities, as well as screening available, genetic screening, and genetic counseling. So what is beta thalassemia? Beta thalassemia is an inherited hemoglobinopathy in which the production of one or both beta globulin chains is impaired. Beta thalassemia is expressed in three different severities: beta thalassemia minor, or the trait, beta thalassemia intermedia, and beta thalassemia major, which is also known as Cooley's anemia. For the purpose of this presentation, we will focus on beta thalassemia minor, or the trait, and beta thalassemia major, Cooley's anemia. The diagram below is going to show the expression of the gene and the likelihood of offspring from two parents obtaining the gene. Just to review a little bit of pathophysiology. Hemoglobin is made up of two proteins, alpha and beta. Hemoglobin is the oxygen-carrying molecule of the red blood cell. So any defect of hemoglobin synthesis is going to affect the oxygen-carrying capacity of the hemoglobin cell, or of the hemoglobin component of the red blood cells, more specifically. Also, the severity of the disease depends on the degree of beta globulin production. So if we look at this slide, if we look at the gene inheritance, if you inherit one mutated gene from one parent, you will have mild signs and symptoms of beta thalassemia, which is also known as beta thalassemia minor, or the trait. The couple number 3 provides a very good example of this. There's an unaffected mother and a father who carries the trait. Of their 4 potential offspring, 2 of them will be carriers of the trait. And so 2 of them will have thalassemia minor with very mild symptoms. Now, if you inherit one gene from each of your parents, one mutated gene rather, from each of your parents, like in couple number 2, where both mother and father are carriers, of their 4 potential offspring, 2 of them will be carriers, and 1 of them will express thalassemia major. Now, thalassemia major is normally detected within the first 2 years of life because of the severity of the symptoms and the growth restrictions associated with it. Let's look at clinical manifestations now. So clinical manifestations in thalassemia minor include fatigue, weakness, pale appearance. You might find also mild jaundice. As compared or contrasted in thalassemia major, you would find a more severe fatigue or weakness, again the pale appearance, jaundice and mild splenomegaly, bronze coloring of the skin, hyperplasia of the bone marrow, facial bone deformities, slowed growth, abnormal swelling, and dark urine. Let's look a little bit at the epidemiology of the disease. Thalassemia in general is a fairly rare disorder, thalassemia minor having fewer than 200,000 reported cases in the United States. Thalassemia major is even more rare, with fewer than 1,000 cases reported in the United States. Thalassemia in general is evenly distributed across the lifespan and equal in both men and women. Risk factors for the disease include a positive family history. Also, ancestry is key. Those from Mediterranean, Middle Eastern, African, and Asian backgrounds have a higher incidence of beta thalassemia. Now let's look at the diagnostics. So, beta thalassemia minor is often found incidentally with a routine CBC. The CBC with smear would reveal hypochromic microcytic red blood cells, as this example here on this slide, where you can see a fair distribution of red blood cells that are normochromic and red blood cells that are mildly hypochromic. What would differentiate this picture from iron deficiency anemia is that in iron studies, the iron would be actually elevated. So that would point you more in the direction of thalassemia other than iron deficiency anemia. Also, DNA testing would reveal the mutation of the genes. Treatment for beta thalassemia minor, beta thalassemia minor requires no specific treatment except for the occasional blood transfusion when indicated if the anemia becomes severe or symptomatic. Beta thalassemia major is treated one of the following ways: with frequent blood transfusion, oral iron chelation therapy in combination with hypertransfusion to maintain the hematocrit above 35, splenectomy in order to reduce the destruction of red blood cells. So those undergoing splenectomy or after undergoing splenectomy should expect lesser need for blood transfusion, since the circulating red blood cells will be able to live longer in the system. And the only curative treatment is going to be that of the stem cell transplant. Stem cell transplantation is very aggressive and not without its risks. But like I said, the only curative treatment for beta thalassemia, it is showing great promise right now. Unfortunately, the genetic nature of beta thalassemia means that it cannot be prevented. However, it is part of the newborn screening of 28 genetic disorders here in Georgia. And there are genetic tests available for those that are at risk. As we said, those with a positive family history or those of specific backgrounds such as Mediterranean, Middle Eastern, Asian, and African. Now, those with the condition are encouraged to undergo genetic counseling in order to prevent passing the genetic trait onto their offspring. The website listed here is actually from the CDC website that will put potential patients or whoever is interested in contact with genetic counselors in your area. There are fair resources available for those with thalassemia. The organization Thalassemia on thalassemia.org lists a plethora of information about the disease, healthy living with the disease, treatment modalities available. It also offers forums for communication for patients and families dealing with the disease. Alternatively, thalassemia.ca is a Canadian organization, very similar in regards to the references, information in general, questions for your provider. Both of these websites offer a very concise area for clinicians as well. if you have questions. There are 7 treatment centers in the U.S. for beta thalassemia, and we're lucky enough to have one very close by at the Children's Healthcare of Atlanta. So once again, as I mentioned before, beta thalassemia major usually is diagnosed within the 2 first years of life. So normally the children, people that are undergoing aggressive therapy for this are children. So in conclusion, beta thalassemia is a rare condition with a reported 200,000 cases in the United States. Its more severe form, Cooley's anemia, or beta thalassemia major, has a reported 1,000 cases. Most people with beta thalassemia minor will live normal, healthy lives with minimal reported symptoms and a normal life expectancy. Genetic counseling is key to reducing the frequency of beta thalassemia in general. Treatment of beta thalassemia major involves blood transfusions, which can result in severe complications such as hemochromatosis and congestive heart failure. Unfortunately, their life expectancy is 4 to 5 decades. Stem cell transplantation is the only known curative treatment, but is not without its risks. However, it is showing great promise. Thank you very much for your attention in this presentation. The following slides will be my references. Please contact me if you have any questions about any of the subject matter presented in this short presentation. Have a good day. Bye-bye.